think Dr. Grover is going to give me a shot.
Yes, in your hip.
And then I'm going to take a Valium. So
And
apparently the shot is painful.
I think so. And they gave you 2 Valiums, and the pharmacist had to come out and make sure that it was going to be used for a procedure. So you styled me today in head to toe homage, the sandals, the jeans, and the top, because it's kind of, even though it's 93 degrees outside, it's really cold.
Inside is very cold.
Mm-hmm. And what are you wearing?
This is a very, very old Chanel top. And then my Express cheap skirt. And my belt is Swarovski and Ralph Lauren sneakers.
Great.
And then my good luck.
Oh, your Van Cleef Alhambra
yes,
necklace. You wear it to the doctor's office all the time. So everyone stay tuned.
Celebrities.
Hi, Dr. Grover.
Hi.
So you are my mom Joanne's pain management doctor.
Yes.
So what did you do today?
Well, so today what we did is we did an injection under x-ray into her hip. She's got a lot of the arthritis and inflammation there. So we put some medication to help reduce that. She did great, tolerated the procedure really well.
Dr. Grover, what was the purpose of doing the injection in my mom's hip today via x-ray?
So she's got a couple of issues going on in the back. She's got some degenerative issues there in the hip and some problems there in the spine as well. So in this first phase, all the MRIs and x-rays will always show multiple problems. That's kind of the norm. What the x-rays and MRI doesn't tell us is which one of these is causing the pain, and maybe it's a combination of things that are causing it. So when we're doing an injection, we're doing it under x-ray guidance, so I know exactly where I'm going. So today, for example, the hip is one of the possible areas of pain along with the spine. So the 2 medications that I put into the hip joint, one is a mapping agent. It's our diagnostic agent. It's called Novocaine. It's actually a longer version of the medication that dentists use to block your teeth, right? So we have one that lasts longer. And what this medication does, it temporarily numbs up just the area that I'm injecting. So I put in a mixture of that medication. So it's important for you to keep some notes about how much relief you get for the first day or 2, because that's going to tell me how much of the pain is coming from that hip. So for example, if you had 100% relief the next 2 days, then I know that 100% of this problem is coming from the hip. If you had 50, then I know 50 is coming from this location and another 50 is coming from somewhere else. So it's a mapping process we use so we can figure out the exact generator of pain. So the steroid part that's in there, that then kicks in after 2 days, and that works on inflammation. So once we know all the sources of pain, then we're in an intelligent position to figure out, what can we do now that we've located it. If it's hip, there's particular things we can do for the hip. If it's the spine, there's a lot of things I can do without surgery in the back to fix it. But this first stage, we're trying to figure out what the root cause is.
Okay.
And then once we know that, then we know the best
So
way to fix
Mom,
it.
you have to then keep a little journal for the next couple of days and figure out, is there any pain? And if there is, where do you feel it?
Okay.
What are the next steps, Dr. Grover?
So right now, like I said, she keeps a record of how she does with the pain. The treatment part will kick in after 2 days, and then I'll see her in the office, and we'll go over like a little chart, and then what the next step.
Okay,
We'll get you all fixed up.
Okay, great. Thanks so much.
You're welcome.